In two-handed knot tying, the first question that must be asked is, which hand are you going to use to do the work of knot tying? In general, as we tie knots, one hand is responsible for a majority of the manipulation of the suture, and the other hand just passively holds the end of the suture, as in the one-handed knot, or just releases and grabs the suture, as in the two-handed knot. For call the hand making all of the posts and loops the active hand, and the hand primarily doing the holding, the passive hand. Now, which of your hands will do what? There's no easy answer to this, but for most people learning this task, the active hand will be the dominant hand, although some learners prefer the opposite. We suggest that you watch the training videos and decide which hand you're most comfortable with doing the active tying. To help make things clear, we're going to put a white glove on the active hand and a blue glove on the passive hand. For two-handed ties, you will use your thumb and index fingers as posts about which you will create loops for your throws. You can begin by either using your thumb or your index finger as a post for the first throw, but let's start by using your thumb. Remember, the goal of the first throw is to bring it down flat. To avoid crossing your hands as the throw is coming down, we would suggest that you cross the suture ends before starting. So cross the ends so your active hand has the one on the bottom. To get started, hook your active thumb around the outside of the suture end in the active hand. Push it to the left, which will create one half of the loop. Wrap the suture in your passive hand around the medial aspect of the thumb, which will create a full loop. Now, oppose the tip of your index finger to your thumb and push your index finger through the loop using your thumb as a guide. With your passive hand, lay the free end of the suture over the index finger and secure it with your thumb. Push your thumb back through the loop and drag the suture through. Grab the loose end of the suture with your passive hand and take up the slack. You have just completed the first throw of a square knot. Bring it down slowly by keeping the tension close to the throw with the index finger of your active hand and tighten it on the hook in a straight line. Note that the passive hand can hold the end of the suture at a distance from the throw, but at least one finger needs to be near the point to be secured. Let's review the throw using the thumb as a post. Cross the end, active hand under passive hand. Hold the ends like the reins of a horse. Hook the active thumb under the suture and push inward. Wrap the other end around the thumb, creating a loop. Oppose the index finger and thumb and push through the loop. Place the free end between the thumb and index finger. Push the free end back through the loop. Retrieve the end with the passive hand and bring the throw down on the hook by maintaining tension with the index finger of the active hand. Now for the second throw. After placing the first throw, we now hold the suture as if holding the reins of a horse. The index finger of the active hand extends over the strand and pushes it laterally. The passive hand loops the free end around the index finger post. The thumb then opposes to the index finger and pushes through the loop. The free end is then placed between the index finger and thumb. The index finger then pushes back through the loop and the end of the suture is retrieved by the passive hand. In order to bring this throw down flat, the hands have to be crossed slightly as the throw comes down. The index finger of the active hand is still used to cinch the knot securely to the hook. Let's practice this again. Hold the ends like the reins of a horse. Elevate your index finger above the suture in that hand and push it outwards. Loop the free end around the index finger and join the index finger and thumb. Push the thumb through the loop, grasp the free suture end and push the index finger back through the loop, Re-grab the free end with the passive hand and cinch the loop down while crossing your hands slightly. Let's put it all together with alternating throws for a square knot. First of all, use your thumb as a post. Bring the suture down with your index finger securely. Now use your index finger as a post. Bring the suture down with a slight rotation of your hands. Now your thumb as a post. Again, bring the suture down with your index finger for security. And finally, use your index finger as a post, and you have completed 4 alternating throws of a square knot. There will be some occasions in which a slip knot will allow better control of the tension placed on a knot. A slip knot differs from a square knot in that the first 2 throws of the knot are not alternated. For instance, as in this demonstration, the thumb is used for the first throw and is also used for the second throw. Note that the loose knot can be moved down towards the hook for appropriate tension to be applied. For these 2 throws, at least 2 more alternating ones should be placed to secure the slip knot with a square knot. Now that you've been exposed to the techniques of two-handed square knots and granny or slip knots, you should devote a lot of time to practice. You should repeat these exercises 20 times, 40 times, or even 60 times in order to gain the skills necessary to perform admirably in the operating room. The next video will cover the one-handed tie.